Lyme disease, comprehensive holistic care, prevention, and integrative treatment approaches in Arizona. Disclaimer: the visuals presented in this video are intended solely for illustrative and entertainment purposes. They do not depict actual medical procedures or treatments performed by our staff. What is Lyme disease, and how does it affect the body? Lyme disease is a bacterial infection caused by Borrelia burgdorferi, a bacterium transmitted through the bite of infected ticks. Only a small percentage of these parasites carry the bacteria, despite their widespread presence. However, if you identify ticks in your home, clothing, or pets, you should consult a medical specialist to guide you on the actions to take. This disease can affect multiple systems of the body, including the nervous system, the heart, and the joints. A comprehensive treatment is necessary to prevent it from becoming a debilitating chronic condition. Signs and symptoms of Lyme disease that you should not ignore. The initial symptoms can vary from person to person. Sometimes, symptoms may not appear until the condition has progressed significantly. Among the most common symptoms to watch for are brain fog, chronic fatigue, muscle and joint pain, mood change, headaches or migraines, heart palpitations. In case of suspected contact with ticks, if you recognize any of these symptoms, it is important to see a specialist doctor promptly. Timely care can prevent the infection from spreading and causing long-term complications. How is Lyme disease transmitted, and why is it often misdiagnosed? Lyme disease is primarily transmitted through the bite of blackleg ticks. However, emerging research suggests that other insects may also act as potential carriers. Moreover, its symptoms can mimic other diseases, such as fibromyalgia, multiple sclerosis, or lupus, leading to frequent misdiagnosis and delayed appropriate treatment. At Mitogenesis, we specialize in the treatment of Lyme disease. Tick bites may initially resemble mosquito bites, often going unnoticed. The first signs of Lyme disease may include distinctive target-shaped rash, accompanied by fever, headache, fatigue, and muscle aches. As the disease progresses, the symptoms intensify, which can lead to joint inflammation, irregular heartbeats, and skin abnormalities. Advanced stage Lyme disease can result in persistent joint problems and other complications. Chronic Lyme disease. Understanding long-term complications. If left untreated, Lyme disease can become chronic and cause long-term complications. Some long-term chronic complications are persistent joint pain, neurological problems such as neuropathy and cognitive issues, sleep disorders, heart problems, debilitating fatigue. Deer ticks, common in certain regions of the United States and Europe, pose a risk of transmitting Lyme disease. Pre-preventive measures are crucial to minimize exposure, such as using tick repellents, wearing protective clothing, and conducting thorough tick checks. Additionally, post-treatment Lyme disease syndrome can occur, leading to persistent symptoms. Diagnosis of Lyme disease in Arizona. Tests and clinical evaluation. The diagnosis of Lyme disease is carried out with a series of tests that, when showing certain results, can rule out other conditions that share the same symptoms. The most common tests are DNA analysis of Borrelia burgdorferi, evaluation of symptoms and tick exposure, inflammation and immune dysfunction tests, Galaxy Diagnostics, iGeneX. To obtain an accurate diagnosis and treatment, specialized clinics like Mitogenesis use a holistic and functional approach. Holistic treatment approaches. Holistic approaches, including intravenous therapy, oxygen therapies, photodynamic therapy, peptides, and immune support, play a vital role in improving overall health, managing persistent symptoms, and aiding in recovery. Holistic approaches also play an important role in recovery by addressing inflammation, the immune system, and detoxifying the body. Natural and integrative therapies used in Lyme clinics in Arizona. Holistic therapies for Lyme disease aim not only to treat the condition, but also to provide comprehensive treatment and results, eliminating the source of toxicity and implementing lifestyle changes that yield long-term results. Some common holistic treatments include hyperbaric oxygen therapy, botanical and peptide IV therapy, nutrition, photodynamic therapy, neural therapy, EBU therapy, true-dose PRP, and more. However, it is important to keep in mind that the treatment must be completely personalized. At Mitogenesis, we conduct a comprehensive analysis and select the best programs to achieve optimal results, not only to reduce symptoms, but also to ensure the patient has a better quality of life. immune support and detoxification strategies for recovering from Lyme disease. To improve recovery, it is crucial to strengthen the immune system and help the body eliminate toxins. This can be achieved through immunomodulatory supplements, infrared sauna therapies to eliminate toxins, adequate hydration and intermittent fasting, stress reduction through meditation and yoga. Prevention of Lyme disease, tips for Arizona residents and travelers. It is important to protect yourself from Lyme disease, and the first step is to avoid contact with the parasites that transmit the bacteria. If you travel frequently or go outdoors often, especially in grassy or wooded areas, take the following preventive measures. Dress to protect yourself, wear light-colored clothing, long sleeves, and long pants tucked into your socks. Avoid open-toed shoes. Check for ticks. Shower after being outdoors and inspect your body for ticks, especially in hidden areas like armpits and hair. Also check your clothes and gear. Additional tips. Inspect your pets outdoors daily. Stay on clear paths in grassy areas and dry outdoor clothing in a hot dryer to kill ticks. FAQs, Arizona Lyme disease treatment. Next, we answer the most common questions about Lyme disease, its diagnosis, and treatment from a holistic approach at Mitogenesis. What are the most accurate tests for diagnosing Lyme disease? The diagnosis of Lyme can be complex, especially if the infection has progressed to a chronic or advanced stage. Can Lyme disease become chronic if not treated early? Yes. If not diagnosed and treated in a timely manner, Lyme disease can progress and become a debilitating chronic condition. This phase can appear weeks, months, or even years after the initial infection. What are the typical symptoms of Lyme disease in the early and late stages? Early stage, days to weeks after the sting. Mild fever, fatigue, headache, muscle and joint pain, target-shaped rash. Late or chronic stages, persistent joint pain and swelling, severe fatigue and weakness, neurological symptoms such as numbness, tingling, and burning sensations, cognitive dysfunction, brain fog, memory loss, poor concentration, headaches and neck stiffness, sleep disorders, mood changes, anxiety, depression, irritability, heart rhythm disturbances, palpitations, shortness of breath, dizziness and balance problems, visual or hearing disturbances. How do holistic doctors in Arizona treat Lyme disease differently? Unlike conventional protocols that often focus exclusively on symptoms, holistic medicine approaches Lyme disease from an integrative perspective, considering not only the infection but the total impact on the body and mind. Why choose Mitogenesis for the treatment of Lyme disease in Arizona? Mitogenesis offers a comprehensive approach that combines functional medicine and natural therapies to effectively treat Lyme disease. Their personalized and multidisciplinary approach helps patients regain their well-being sustainably. Prevention and early diagnosis are key to avoiding complications of Lyme disease. At Mitogenesis in Scottsdale, Arizona, we are committed to your health and well-being, offering integrative approaches for Lyme disease and other co-infections. Call 480-781-4800 or send us an email at info@mitogenesis.health for more information. Disclaimer: the information in this video is provided for informational purposes only and is not a substitute for the advice of your physician or other healthcare professional. Do not use the information to diagnose or treat a health problem or disease. Always consult with a healthcare professional before taking any medication or nutritional, herbal, or homeopathic supplement, or using any treatment for a health problem.